Northern Gaza's only functioning hospital is now out of service after an Israeli military strike. The attack on al-Ahli Baptist Hospital destroyed its emergency unit and a facility storing medical oxygen for intensive care patients. Hospital staff had to scramble to empty the facility after a forced evacuation order from the Israeli military came just minutes before the strike. Many are now sheltering on the streets near the hospital. Dr. Mads Gilbert is an emergency medicine doctor and professor who's provided healthcare in Gaza for more than 30 years. He joins us now from Tromsø in Norway. Good to have you with us. So, first of all, just take us through how shocking it must be for medical professionals like you to see scenes like that of patients having to flee a hospital at night in the dark because of an impending Israeli strike.
Well, my first reaction is really this. What kind of cowardice, sadistic, and completely amoral army will attack a hospital with sick and wounded people in the middle of the night? The same army who has killed maybe up to 80,000 people, of whom the majority are children and women. This is so cowardice, this is so amoral that it's hard to find words to describe it. And as for al-Ahli Arab Hospital, I know that hospital well. It's a well-run, very important medical institution in North Gaza. And for the time being, it was the only trauma center because of the damage of Al-Shifa Hospital, which used to be the trauma center. So what happened this last night is actually a death sentence to anyone who sustains major injury or trauma or has a surgical condition who needs surgery, because this eliminates...
Let me jump in and bring to you the Israeli line. They say that Hamas was using this hospital. Is that a justification, your understanding of international law regarding medical facilities?
No, it's not. Number one, it's not a justification because you have the protection, priority, and proportionality, which are the governing principles of the Geneva Convention, number one. Number two, the Israeli occupation army has never, ever been able to show any evidence or proof that the Palestinian hospitals are some sort of command centers. They've been claiming this since 2006, and they have been systematically attacking healthcare, not only hospitals, but ambulances and primary healthcare centers. So this is one other of the many lies they perpetrate in order to defend what they are doing, namely laying the ground for the ethnic cleansing of Gaza, because they will make life so completely unbearable through starvation, lack of water, lack of healthcare, and lack of human security. So this is all ingrained in the Israeli occupation army's politics of destroying the social fabric of Gaza. And this attack on Al Arab is, as I said, a death sentence to anyone who will need surgery in northern Gaza now during attacks or for other medical conditions, because the operating rooms, the ICU, and the oxygen producing capacity is now down to zero in al-Ahli Arab. So this is a war crime aired live. Everybody can see it. And where are the Western governments? Where are the Arab governments to stand up and sanction Israel to stop these war crimes attacking the Palestinian people in Gaza? It is beyond comprehension that this is allowed to go on with impunity for Israel.
We've heard from the Israeli Defense Minister, Israel Katz, saying that the gates of hell will open in Gaza. Do you see a link between what we're seeing now with strikes on humanitarian institutions, the things that can keep people alive, and with statements promising to open hell on people?
Well, that's a very good question. And I think I'd actually prefer to be in hell than to be in Gaza now. I think what is going on in Gaza is making Dante's Inferno look like a tea party, because what's going on is a very systematic, very cynical, and I would add sadistic way of undermining people's capacity to live. Because you don't have to be a doctor or a professor to understand that if you are denied food, water, and somewhere to stay safe, you can't have health. And when you, on the other side, systematically attack healthcare, of course, this is part of a plan. And the plan is the systematic ethnic cleansing of Gaza, and it goes hand in hand with the genocide going on, with more than 80,000 killed and 120,000 injured. No healthcare system in the world could actually apprehend this number of tasks. And let me add, it is only thanks to the brave work of the Palestinian healthcare workers in the remaining hospitals, in the ambulance services, and the civil service in the civil protection units that there is still some functioning healthcare in Gaza. They are doing a heroic work, and they are actually holding the moral compass of the world these days.
All right, Dr. Mads Gilbert, emergency medicine doctor and professor, thank you so much for joining us.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.